Hope your work week is off to a good start. You're watching Arirang TV's continuing coverage of COVID-19. I'm Min Sun-hee. The number of confirmed coronavirus cases has surpassed 29 million worldwide. Meanwhile, here in Korea, social distancing in the metropolitan area has been eased to level 2 from level 2.5. Now, we have more on that measure later on in the program. Here first are the latest numbers on the pandemic with our Kwon So-ah. So we ended last Friday with more than 170 new cases. How are we starting this new work week?
On a better note, Sunny, we are seeing a gradual decline in new coronavirus cases. And also, since Sunday, we are seeing less than 100 domestic infections. And it is also Sunday when the government announced the downgrading of social distancing measures in the metropolitan region from 2.5 to level 2. And they took into account the hardships of business owners as well as the relatively stabilizing numbers of coronavirus infections. Now, despite eased social distancing, however, the government laid out stronger guidelines for certain venues, such as eateries. For instance, better record keeping for entry logs, as well as stricter measures regarding seating arrangements, and instead of closing at 9 p.m. And also, franchise coffee shops will be operating again, however, again, under stricter enhanced rules. So if people continue to not let their guards down, we might see a drop to the double digits soon. But as of this Monday, we have 109 new cases, raising the total to 22,285. Unfortunately, we have 5 additional deaths, raising the death toll to 363, and 159 people less in quarantine. However, the number of people in serious to critical condition also is about similar at 157. Meanwhile, we have 263 new recoveries. And for the 12th straight day, cases are lingering in the 100s. And we can see a couple of positive developments. First off, 10 less cases compared to last Monday. And also since Friday, we are seeing a gradual decline in new COVID-19 cases. But we also have to factor in again that there are less tests conducted over the weekend. So we will have to take a look at the rest of the week as well. Going over to our map, around 80 cases reported in the metropolitan region this Monday, 41 in Seoul, followed by 30 in Gyeonggi-do province and 10 in Incheon. And we also have 11 cases that were reported as overseas cases this Monday.
Right. So on the global front, as I mentioned earlier, more than 29 million cases worldwide. And I understand a daily record was noted this past weekend.
Exactly. The World Health Organization reported a record single-day increase in global COVID-19 cases on Sunday. Here we see the number on the screen, 307,930. So a number above 300,000 is really a reason for concern. Now, as of noon Korea time, the number of total cases stands at over almost 29.2 million cases and over 928,000 fatalities and some 21 million recoveries. And let's take a look at the countries that have been hardest hit around the world. 6.7 million in the US, 4.8 million in India. And this country reported over 93,000 cases in just a single day. And also, all of these 10 countries here have cases above 500,000. Let's move over to other places now. We're seeing a concern in France that is dealing with a second wave of the pandemic, having recorded 10,000 new cases on Saturday. And then here in Iraq, cases are also inclining, which has surpassed the total figure of Italy. And those are the figures I have for now, but I'll be back with more updates after the government briefing. Sunny?
All right, so thank you for that. I'll see you back at the desk. In related news, the pandemic has pushed demand for robots to take over tasks in high-risk areas to limit human exposure to COVID-19. We have details in this next report.
In an effort to minimize person-to-person contact amid the COVID-19 pandemic, new robots are being developed to assist or even replace human laborers. A team of Korean researchers recently developed a robot that allows medical workers to take COVID-19 test samples from a patient remotely. Meanwhile, an advanced quadruped robot named Spot, developed by US-based engineering firm Boston Dynamics, is now available for purchase and promises a wide range of applications. Spot was seen patrolling the streets of Singapore to ensure social distancing measures are being followed.
Let's keep Singapore healthy. For your own safety and for those around you, please stand at least 1 meter apart. Thank you.
Here in Korea, a local firm deployed Spot at one of its construction sites. In the place of human workers, Spot is checking for any defects in the building, helping to minimize person-to-person contact and preventing a COVID-19 outbreak at construction sites. Next up, we visited a cafe in the city of Incheon, west of Seoul. Behind the counter, a robot barista is making coffee and other drinks for the waiting customers. All you have to do is place your order at a kiosk, and a robot barista grinds the beans and brews the shots of espresso. So does the coffee taste any different from one brewed by a human barista?
처음 왔는데 일단은 재밌는 것 같고 그 로봇이 하니까 사람이 하는 것보다 더 깨끗할 것 같고
장점으로는 커피가 균일한 맛이 나고 속도가 빠르며 청소까지 해줘서 편리합니다. 주문 제조까지 로봇이 위생적으로 하고 비대면 서비스라는 장점이 있기 때문에 현재는 상주 직원이 있지만 향후에는 완벽한 무인화 시스템을 구축하고자 합니다.
Disinfection robots have also stepped into the spotlight amid the COVID-19 pandemic. This disinfection robot uses UV rays and liquid solutions to kill harmful microorganisms such as viruses, bacteria, and fungi. We visited a local firm that developed this robot to learn more.
올 초 코로나 사태를 계기로 인해 방역에 대한 중요성이 높아진 만큼 기존의 기술력을 활용해 인화 케어라는 자율주행 살균 로봇을 개발하게 되었습니다. 가장 큰 장점은 로봇 스스로가 다양한 장소를 이동하면서 방역을 하는 무인 방역 시스템으로 기존의 인력 소모 측면이나 방역 자체에 대한 부담을 줄일 수 있는 자율주행 로봇의 장점을 말씀드릴 수 있을 것 같습니다.
The company is continuing to research and develop other types of disinfection robots.
집중의료기관이나 호텔, 전시회장 같은 다중이용 시설에서 요청이 가장 많이 들어오고 있고 공장 같은 생산 현장이나 일반 대형 건물들의 문의 또한 꾸준히 들어오고 있습니다. 코로나가 지속되면서 점점 수요가 늘 거라 예상됩니다.
The COVID-19 pandemic has accelerated our drive towards automation, bringing permanent changes to the way we work and the way we live.
Right, it's time now for the regular afternoon briefing on COVID-19 here in the country. Chung Eun-kyung is poised to give her first address as the Commissioner of the Korea Disease Control and Prevention Agency, the KDCA, today. As mentioned earlier, level 2.5 social distancing in Seoul, Incheon and Gyeonggi province has been eased to level 2, that is. Perhaps the most visible change amid the ease in level is the reality that restaurants, bakeries and food trucks can serve diners at their premises even after 9 in the evening. Also, franchise coffee shops can host patrons at their establishments, and indoor sports facilities and small-scale cram schools can also resume business. All those choosing to visit these establishments that are open have to provide their personal information, while the establishments themselves have to abide by stringent social distancing and hygiene measures to prevent infection. Now, while we wait for the briefing to start, perhaps we can look at the social distancing guidelines under level 2 to remind ourselves of the measures under this particular level. Gatherings of more than 50 people indoors and 100 outdoors remain banned. Professional sports games can take place in the absence of spectators at stadiums. Operations at high-risk establishments, including buffet restaurants, clubs, bars and singing rooms, as well as cram schools of more than 300 people, remain suspended. Internet cafes, however, have been removed from the list of high-risk venues and are allowed to open, but cannot accommodate minors nor serve light meals. The ban on in-person religious activities remains in place, and no visitors are allowed at homes for the elderly. Remote learning and working are strongly advised. Up on the screen, we can take a look at today's numbers as well. Korea has recorded a total of 109 cases on this Monday, the lowest since August 14th, when authorities noted 103 cases. Following a surge to 176 infections last Friday, the number of daily cases has been on a slight decline, with 136 on Saturday, 121 on Sunday and 109 today, raising our total to 22,285. The number of patients who lost their lives rose by 5 to push the country's death toll to 363. Now, Korea's fatality rate currently stands at 1.6%. The patients in critical condition, as our Kwon-Soo mentioned, in serious to critical condition, that is, stands at 157. As of this Monday, some 40 critical care beds are available nationwide. Meanwhile, more than 18,000 have survived the virus, while more than 3,500 are actively fighting the virus here in the country. Now, we are still waiting for that briefing to commence. It has yet to start, and while we are waiting, perhaps we can have our Kwon-Soo back with us to tell us a bit about the international numbers for this Monday. Right, so on the global front, as I mentioned earlier, we have more than 29 million cases worldwide.
Yes, that means we are close to 30 million. I don't want to predict that it's going to happen soon, but we are seeing also an uptick in daily new infections on the global front. As I mentioned earlier, over 300,000 were reported on Sunday, and also today we see around 240 to 250,000 cases. So we are probably going to have to deal with a pandemic for a much longer time than we have been expecting earlier when the pandemic began. And also one of the countries that are really dealing with resurgences in cases is India, with some 93,000 cases reported in just a day. And also we're seeing Europe, which have been reopening its economy in many places. There are many new cases, new resurgences, for instance, in France and the UK, especially France is dealing with really high numbers these days. I think the briefing is going to start now.
Right, so thank you for that. I'll come back to you later. The briefing has started, as our Kwon-Soo mentioned. We'll come back to you afterwards.
Let us now begin our regular briefing on the COVID-19 response here in South Korea. As of September 14th, Monday, we have 98 new local infections and 11 new imported cases. The total caseload now stands at 22,285. Currently, 3,433 people are in quarantine undergoing treatment, and there are 157 patients with severe or critical conditions. We had 5 additional fatalities as of yesterday, and I extend my deepest condolences to the deceased and the members of the bereaved families. Let us now take a look at our updates on domestic infections by region. In relation to August 15th Seoul rally, we have 2 additional cases being confirmed. In total, we have 579 cases being confirmed. And in Gyeonggi-do province, in Bucheon City, in relation to the TR Innovation Sarah Queen, we have 2 additional cases being confirmed at Sarah Queen, and in total we have 16 cases being confirmed to date. And investigation have shown that we also found a link with the OK Link, as well as other outsourcing companies, and we have found major contacts. And so we advise all of the people who have been going to these TR Innovation Sarah Queen and OK Link as well. So if you have visited these firms during a certain period of time, we ask for you to get tested as soon as possible if you have symptoms. And moving to Gyeongsangbuk-do province, in Chilgok-gun County, and in relation to a business consultation group, there we have additional cases, and in total 16 cases have been confirmed to date. And now moving on to imported cases, we have 11 new imported cases being reported yesterday. We have 5 from points of entry, and 6 have been reported through community transmissions. And also we have found that all 11 of them were foreign nationals, and 6 were from Uzbekistan, 2 from the Philippines, and 1 from India and Qatar, respectively. And during the past week, we have seen some risk factors, and here are some details. As for the domestic infections during the past week, we have found that they hovered around 143.6, which is a decline by 83 people. And also, as for the transmissions in the metropolitan area, it has decreased by 62.1 compared to the previous week. And also, we have seen a slight increase in the number of imported cases, standing at 14.1. And we also found that there is a slight decline in the age group of 20 and 30, and while there was about 5% increase in the patients over the age of 60. And we have seen some 1,000 people declining on the number of people in quarantine. And as for now, we have 3,433 people in quarantine, and we have found that 1,300 of them are over the age of 60, accounting for about 40% of the entire total. And also among them, 10% are being categorized as severe or critical conditions, and this is why we call for particular precautions for the senior citizens. And as for sources of infection, we have found that 33% are related to contact with previous cases, and there are also about 23.5% which are under investigation. And as for the major sources of infection during the past week, we see major venues as religious facilities, door-to-door facilities, as well as other multi-use facilities and medical hospitals. And these cluster infections are continued to spread. And in order to prevent the virus, we need to take note of these venues, these diverse venues, and we need to also take particular precautions when you use these particular venues. As for religious facilities, you need to switch all of the religious services to non-face-to-face means, and you need to also postpone or cancel all small group meetings and group dinings as well. And also, the senior citizens have a higher rate of developing into critical conditions. And as for the multi-use facilities used by these senior citizens, like nursing hospitals and nursing homes, we need to advise the managers and staff members there to have a strict control of the number of visitors, and also do not visit publicly used facilities such as cafes, restaurants, bars, pubs, and so forth. And also, when a patient is being admitted to the hospital, as for the COVID-19 testing for these inpatients, we are also covering with our national health insurance, and we are also carrying out and expanding our scope of sample testings for the people who are administered at these nursing hospitals. And secondly, we also would like to note that particular precautions need to be taking place at business seminars that are hosted by door-to-door sales. And many of the senior citizens are exposed to the virus at these places. And there are many business seminars which involve health supplement or other business seminars. And please note that they are carried out at enclosed spaces with crowded environments. So we ask the senior citizens to refrain from visiting these venues. And in order to curb the spread of the virus, we also ask you to intensify inspections on these door-to-door facilities, and they will be carried out by local governments, and we will also have stricter rights of indemnification for those who breach these measures. And as for the eateries, including restaurants and cafes, we also ask all of the staff and users to abide by quarantine measures. And also we ask the general public to cancel or postpone non-essential outings, social gatherings, events, or travel. And if you have to go outside, please abide by quarantine measures such as wearing face masks and keeping healthy distance. And next, we have some updates on our antibody testings in relation to our public nutrition survey. And this is our second round of investigation. And we have carried out about 1,400 serums of samples, and we have confirmed that one one case have tested positive. And as for your information, we have conducted about 1,500 testings, and there were 0 cases of positive. And in the second round of testing, we have found that starting from June 10th to 13th of August, these were the period of time when the samples were collected, and we have held experts meetings, and we have confirmed that these are before the 14th of April. So this has limitations in explaining the current major outbreak that happened after the 15th of August. And also we have also need to consider the fact that we have a lower risk, lower number of domestic infections in mid-June. And also these are some effects of, we have to also factor in the intensified quarantine measures and the social distancing measures that have been carried out by the public. And we will be carrying out these national public surveys going forward. And we also have included some samples of medical practitioners, as well as the entry soldiers as well. And also we have carried out, we will be carrying out intensified surveys and collecting a more wider sample to enhance the representativeness of these samples and testings. Starting from today in the metropolitan area, we have the easing and downgrading of the social distancing measure to level 2.5 to level 2. And starting from mid-August, we have seen a major outbreak in the metropolitan area. However, we were able to curb the further spread of the virus thanks to the participation of the public. And once our on-day increase peaked at 300, however, this has come down to the 100s. We believe this is all possible due to the cooperation and support extended by the members of the public, and I would like to extend my deepest appreciation to you all. However, we shall not let our guards down yet, because the metropolitan area is a very congested area, and we have on daily average cases about 100, and there are about 20% of the daily cases that are not traceable. And also there are many cases that are beyond our quarantine control, and this is why we need to also continue to stay alert. Globally as well, the COVID-19 virus is spreading at a fast pace. On-day increase, we have also set a new record with about 310,000 new cases on a daily basis. And we also have many resurgences of the virus, and especially in many countries across Europe as well. And it is very difficult for many countries to strike a balance between their daily routines, their economic daily routines, as well as quarantine measures. And we need to also curb the further spread of the virus in the metropolitan area. And we need to fully prepare for our Chuseok holiday, which is upcoming. And also we need to also have a very important task to fight both the influenza and COVID-19 going forward, especially during the winter. And we need to contain the virus and flatten the curve going forward so that we can have a full control of the situation going forward as well. And we have our experience for the past 9 months, how we can prevent the virus and how we can control the virus. So we have some knowledge to a certain extent. However, the issue is of practicing. So we need to also have the change of our perspective to how we can really protect the lives of ourselves and our neighbors. So it is very important for us to wear face masks and keep healthy distance and wash our hands on a regular basis and prevent the so-called 3C environment, which is closed, crowded, and close contact environment. And we need to also come up with new normals and new practices and new quarantine practices so that our daily routines are not hindered. And our local authorities and the quarantine authorities will also exert our full efforts through cooperation, and we will also make sure that we will improve our institution to provide full support. Thank you very much.
Right, there was Chong Young, the Commissioner of the Korea Disease Control and Prevention Agency, with Monday's afternoon briefing. So do give us the gist of her address today.
Sure. Well, first off, let's take a look at some assessments of the past 2 weeks. Tong mentioned that there has been quite a decline in new daily cases, and that goes for the entire country as well as for cases in the metropolitan region. And there's been a slight uptick in cases from abroad, and it looks like people aged 20 to 30, the number of patients there went down, whereas people aged 60 and above, there is an increase in patients in that age group. And she also had some results of a second round of antibody tests that came out. It looks like 1 out of 1,440 people tested positive for COVID-19 antibodies, but it has to be mentioned that this investigation was conducted until mid-August, around mid-August, which means there might be some restrictions to the results, but our expert is probably going to have more on that later on. And in the meantime, Tong also mentioned that we are still at level 2 social distancing measures, so we should not lose our vigilance.
Of course. All right, so thank you for that. I'll see you again tomorrow.
See you tomorrow.
아직 하루 확진자가 2자릿수로 줄지 않고 안심할 수 있는 상황은 아니지만 그동안의 방역 강화 효과가 조금씩 나타나고 있습니다.
The level 2.5 social distancing in the Greater Seoul area has been lifted to make way for the level 2 measures currently in effect across the country. Authorities have nonetheless revealed intentions for tougher containment efforts during the Chuseok holiday, which begins late this month. For more, I have Dr. Alice Hyun-Kyung-Tan from Ms. Mary Women's Hospital. Pleasure to have you back, Dr. Tan.
Thank you.
And I also have Dr. David Kwak from Soonchunhyang University Hospital. Welcome back, Dr. Kwak.
Good afternoon.
Meanwhile, over in Australia, I have Professor Sanjaya Senanayake from the Australian National University. Hello, Professor Senanayake.
Hello, how are you?
Fine, thank you, Professor. Dr. Tan, perhaps we can start with you. Let's begin with your thoughts on the government's decision to ease level 2.5 social distancing here in the metropolitan area.
Well, whenever we make decisions about what kind of degree of social distancing we are going to implement, we have to take a number of factors into account. First of all, the availability of healthcare resources to take care of everyone who's sick, but also isolate everyone who is positive. Secondly, the availability of the epidemic investigators in terms of tracing and tracking capabilities that was getting overwhelmed a few weeks ago. Then we have to consider the overall direction of the trend. Is the infection under control or not? And the basic reproductive number can help determine that for us. The last is the will of the people. Basically, because these restrictions involve so much loss of freedom and there are so many socioeconomic side effects, we have to determine whether or not people are willing to go through with these measures to get infection under control, because the best guidelines at the end of the day are only as effective as to the degree to which they are followed. In terms of the numbers, they show that we are beyond our peak. That seems to have happened September 3rd, and that's when we had the highest number of active cases. Total active cases was 4,786 that day, and also the total number of cases of unknown epidemiological link. That peak was 1,280 on that day. My concern is that I'm not sure that we are beyond the peak or safely beyond the peak of critical and severely ill cases. The highest number so far was 175 of these cases, but that was only a few days ago, September 11th. And the trend in terms of the demographics of the active cases that are being diagnosed daily show that greater than 30%. So yesterday it was 38% of the new cases were age 60 and above. These are high-risk cases. What that means is we may see going forward, now that the restrictions have been eased, about 50 high-risk cases being diagnosed on a daily basis. And so we have to ask, is that acceptable? Also, the number of deaths. This number has not stabilized. If we look at the number of deaths over the last week, so September 7th through the 13th, that total was 24, whereas 1 month ago, for a 1 week period in August, early August, that total was 3. So there are a lot of things to take in mind, and it's up to the people to decide if this level of death due to a preventable disease is acceptable. And if not, what do we have to do as individuals and as institutions to prevent COVID-19 from taking so many lives?
Your numbers do put the situation under better perspective. Dr. Kwak, there was belief, there was hope that the practice of level 2.5 social distancing would reduce the number of daily caseloads to the double digits, but this has not occurred here in Korea. What do you suppose is the reason for this?
Well, I don't think 2.5 completely failed. It still worked. We're just seeing the decrease of the numbers too gradual. We're still seeing numbers have gone down to possibly 2 digits. I'm not just talking about the number from yesterday, but the day before, we also saw possibly 2 digits of a newly daily case numbers. So I'm still staying hopeful. But as Dr. Tan mentioned also, it's more of a matter of how we're going to enroll our citizens to participate in this, taking this measure and actively doing the social quarantining. Meaning, this is, whether it be 2.5 or even at the level of 3, what matters the most is really people taking parts in it and really keeping the social distancing and physical distances. So in a matter of talking about 2.5 or versus 2.0, I don't think it really matters that we brought down the limitation to working hours for people from, let's say, 12 a.m. to 9 p.m. That's not what really matters. What really matters is how people became more aware of the current situation, or for some people who could possibly have become more scared about the situation, and they have finally decided not to go out or not to meet the people that they were supposed to. So it's not really so much about the numbers I'm more interested. It's more about how are we going to get the citizens to be involved and really actively participate in the governmental measurement that they want to take on. So I don't think the measurement 2.5, level 2.5 has failed. It worked. It's still gradually declining, but I'm just hoping that maybe for the next a few weeks or so, I'm hoping that the citizens themselves will take much more active role in the keeping of measurement.
Right, of course. Professor Sinanayaka, Australia has been in lockdown since July, and in recent days there have been protests in the state of Victoria amid a declining number of new cases, though. Please tell us more about the situation there, Professor.
Yes, so Australia's had about almost 27,000 cases and about 800 deaths. But we've had our second wave or surge or whatever you would like to call it in late June, early July. But that was centered around the state of Victoria, particularly the city of Melbourne. And the reason that it occurred was there were breaches in hotel quarantine, which is, of course, our highest risk population for COVID. These are the people who've come from overseas, so the chance of them having COVID is relatively high. And there were, unfortunately, a number of breaches there, and then it spread from there throughout the city of Melbourne. And to create the perfect storm, it unfortunately got introduced to a number of residential aged care facilities. And as we all know, elderly people are particularly vulnerable to this infection. So we've had a number of deaths associated with that. And of course, from Victoria, it spread northwards to New South Wales, particularly Sydney, and to Queensland. But however, in both of those cases, the numbers are much smaller and they're under control. And Victoria, after a prolonged period of stage 3, then stage 4 restrictions, are starting to see the numbers come down. So they're in double digits. So we're turning the corner finally.
I see. And despite that reality, there are public protests, even this past weekend. Why, Professor?
Oh, look, I think we're seeing this around the world. There's fatigue about having to be in lockdown and have the restrictions. And as we all know, the psychological, social, and financial consequences of these lockdowns, though they may be necessary for health reasons, can be devastating for people and their families.
Right. Professor Senanayake, countries in the Northern Hemisphere, like Korea, are heading into the flu season. And there are concerns over the possibility of a twindemic, so to speak, amid the pandemic. Now, Australia lies in the Southern Hemisphere, and I am aware that authorities there successfully dealt with this dual challenge, so to speak. Could you tell us more about this?
Oh, I love the term twindemic. That's really clever. But in terms of flu, yes, we were concerned that when winter came, we would see high levels of flu and COVID. And there's also a concern if those two infections happen together, there'd be a higher risk of super spreading events. But in fact, it's been quite the opposite. Last year, we had a very bad flu season. We had about 300,000 odd laboratory notifications of flu. This year, we've only had 20,000. So that's more than a 90% drop in flu notifications. Now, as my fellow panelists know, flu seasons vary. So you'll often have a terrible season, the next year you'll have a mild one. So it could be partially due to that. But also, we have encouraged the Australian population to take up the vaccine. And we believe, I think for the first time in a long time, we may have achieved herd immunity by such a high uptake of the vaccine. And of course, the physical distancing has made a big difference too, particularly with the closure of schools for a period, because as we all know, children are major drivers of community transmission of influenza. So from an Australian Southern Hemisphere point of view, flu has not been a problem.
I see. Dr. Tan, as Professor Senanayake just mentioned, that the flu was not a problem in Australia. Do you suppose it would be possible to have that reality here in Korea? We have had the government talking about free vaccination for 19 million people this year.
Hopefully it will be true. So I know that the government is making plans to secure 30 million doses of the influenza vaccine for this upcoming season. And of course, priority will be given to people who are at the highest risk of having poor outcomes due to influenza. And so hopefully we will be able to vaccinate all of those people who are at the highest risk. Now, 30 million doses translates roughly to 60% of our population. Hopefully, we will be able to protect those who need it the most. But as our doctor said in Australia, there is an umbrella protective effect of all of the infectious disease prevention and control that's going around for COVID-19. All of the social distancing, the closure of schools, wearing of masks, washing of hands, that will also decrease the amount of influenza. If we happen to have a good match of the circulating strains of the virus, influenza virus, with whatever vaccine is available for our population, that will also work in our favor. But we will see. Hopefully, we will be able to avoid the twindemic.
Right. Dr. Kwak, pharmaceutical firm AstraZeneca and Oxford University have resumed clinical trials of their COVID-19 vaccine candidate in the UK after a brief global pause in testing following an adverse reaction to a trial participant that is in the UK who reported developed a severe neurological problem. Do you expect to witness similar scenarios in the quest for a vaccine even in the future?
It's a possibility. One thing I would like to point out is that it's a routine procedure. So when a vaccine or a certain treatment goes into trial number 2 or trial number 3, they have to find out whether people who are receiving the injections can possibly have this. So in this particular case, I think it what it shows us is that the safety system, the safety guard actually has worked, that it found that one particular person, to my knowledge, he or she had a acute transverse myelitis, which is also a certain side effect we warn against when giving routine vaccinations in Korea. So it's not something completely out of the ordinary that what we just noticed, but hopefully it won't ever happen again in the future for the development of vaccinations, because normally we would expect to see this occur in a real life situation, one in possibly 800 million to my knowledge, or to even 1 trillion of numbers. In this case, they were enrolling 30,000 of participants, and they already found one member who actually went through a severe side effect. So hopefully it'll stay number 0 for the rest of the trial, and hopefully we'll come up with some sort of vaccinations pretty soon.
Right. Professor Senanayake, Australian Prime Minister Scott Morrison backtracked on remarks that a free COVID-19 vaccine would be as mandatory as possible when it's available. What are your thoughts on this?
Yes, so I guess this is the most important issue for all of us right now, a vaccine, a viable vaccine for COVID-19. So the federal government here has gone a long way to negotiating deals for doses of vaccine. So I think we'll have about 50 million doses sometime next year. But of course, we want people to take the vaccine. Otherwise, if there's low uptake, there's no point in having all the vaccine. So he initially talked about making it mandatory, but because Australia is, I guess, one of the liberal democracy, there was debate and controversy about that, and he backtracked. Now, having said that, although we want lots and lots of people to have the vaccine, if we look at the R0 of COVID-19 being 2.5, we probably don't need to have huge numbers of people vaccinated. We may not need 99% of people to have the vaccine if the vaccine is very efficacious. And in Australia as well, even though we have issues with vaccine hesitancy and anti-vaccination groups, they're very small. So I suspect we will get high uptake of this vaccine when it is introduced, hopefully next year.
I see. Dr. Tan, here on the local front, authorities have revealed intentions to mass produce an antibody treatment of COVID-19 later this month. Could you tell us a bit about this antibody treatment?
I think you're referring to a monoclonal antibody treatment called CTP59, and this is made by the Celltrion Group, a biotech company here in Korea. The company just announced recently a favorable safety profile of their phase 1 trial using this medication. And they said that they are hoping to have full development of this medication by the end of the first half of 2021. Full development means that we still have to wait for mass manufacturing, packaging, and delivery. So I think it's a little bit too early to get our hopes up for this medicine to be available wide scale in Korea. However, it's good news, and it's something that we need to watch very carefully, and hopefully it will work.
Dr. Kwak, in today's afternoon briefing by Chung Young, the commissioner of the KDCA, she spoke about the results of the second antibody tests, the studies that we had on citizens here in Korea. And she claims that out of 1,440 people tested for antibodies, one tested positive for the antibody, for immunity against COVID-19. Now, this compares to the study we had earlier, where we had one person testing positive from, I think it was about 3,055 people. What are your thoughts on the results of the second antibody study here in the country?
Well, I would like to make a couple of different notes here. The second trial with the testing, I believe, is very similar to the result of the first trial, that they found possibly 0 or 1 person out of possibly 1,400 people to have antibodies. This number of testing people, the number of people who were tested, is yet too small to represent the whole nation. We have over 50 million people in Korea, and 1,400 people are just not going to cut it to actually represent that big of a number. Number two, antibody is not the only immune reaction that a human shows when exposed to a virus. And in the case of Sweden, when they actually conducted the national population antibody testing, as the country that was exposed to the virus, as Sweden was, they were only able to find 15% of the population to actually have antibodies. They also concluded, in the Sweden study, they also concluded that there's a certain viral reaction called T-cell reaction, and we haven't looked into this yet also. So I'm staying hopeful that actually this is rather clinically insignificant, and much more people will actually be more immune to the virus.
I see. All right, Dr. Kwok, as always, thank you for your thoughts. And Dr. Dan, thank you for being with us. And over in Australia, Professor Senayaka, thank you very much for making the time to join us live at this hour.
Thank you.
Right, well, that ends our program for this Monday. Do join us again tomorrow at this hour as we further explore the impact of the pandemic on the cultural scene. In the meantime, do take care and thank you for watching.